Okay, so now I'm just going to read a few words about our speaker tonight, Dr. Eileen Reilly. After graduating from the University of Massachusetts Medical School and completing her residency in psychiatry, Dr. Reilly has focused her work with homeless persons experiencing psychiatric illness. While beginning her volunteer work for Boston's Pine Street Inn, as well as the Women's Lunch Place in Boston, she's continued on to work for the Massachusetts Department of Mental Health. She currently facilitates care to homeless persons at St. Francis House, Women's Lunch Place, and Boston's Pine Street Inn. Now Dr. Reilly continues educating others about caring for homeless persons, is on the faculty at Harvard Medical School, and has received the Massachusetts Psychiatric Society Award for Outstanding Political Service. So now I'd like to welcome Dr. Reilly to the podium.
Hi everybody, it's great to be here and I'm so happy that everyone's here to learn about homelessness because I love talking about it. It's been my passion since I was actually in college, and the way I got introduced to homelessness was I was going to a church right up the street and they were asking for people to volunteer at the homeless shelters. So I naively raised my hand and said, okay. And so they told me to go to the Pine Street Inn. I was 21, really shy, and I went in and there was 300 homeless men. A lot of people were intoxicated, a lot of people mentally ill, one guy sleeping in the fireplace. And I thought to myself, I think I picked the wrong volunteer job. But I went through the night and there was a nurse's clinic there and they really needed help. It was really hard to recruit nurses to come to the shelter at night to be in the clinic. So, and there was one nurse there, Barbara McGinnis, and I don't know if people have heard of her, but she's a legend. She's deceased, unfortunately, but she was a legend. She worked at Pine Street for 40 years and, inspired people to do healthcare for homeless people. So she, I think she definitely picked up that I wasn't totally comfortable and I might not be coming back. So she, at the end of the night, she shook my hand, looked me in the eye and said, "We will see you next week, won't we?" So that was the beginning, and I thought, because I was a shy, obedient kid, I thought I better come back. And that just opened my eyes to, people's experience of being homeless and the different stories. And I just got addicted. It didn't take me too long, and I just loved, it was like once a week after work I'd go and I started, I was a volunteer and then I became a full-time worker there. And one of the reasons I became a full-time worker there was because Pine Street had always been for men. And then in '82, they opened up a women's unit. And that was really exciting because up until then, there was no place except Rosie's place for women to go to. And there, because it was so crowded, they had a 2-week limit. So people could be in for 2 weeks and then would have to leave for maybe a month and then be able to come back. But Pine Street was open to everybody, so that was really exciting. And I got to work with Bob McGinnis, opening the clinic for women. So healthcare for the homeless is, I don't know, did a lot of people read the book by Tracy Kidder, Rough Sleepers? Yeah. This is the program that Jim O'Connell founded, Healthcare for the Homeless, which I work for. So what my job is a little bit spread out. I work for Department of Mental Health, seeing people in shelters, and then I work with Healthcare for the Homeless on the street team, seeing people on the street. So I'll just tell you a little bit about Healthcare for the Homeless. It was founded in '85, and it's really a nationwide program. So many cities have Healthcare for the Homeless, and it was there was money contributed by the Robert Wood Johnson Foundation in '85, and that began Healthcare for the Homeless programs. In '86, the street team medical services began, there was Pine Street had a van that went out, has a van that goes out at night. So a physician from Healthcare for the Homeless went on the van once a week. And the van is not medical care, it's giving out blankets and soup and coffee to people that sleep outside. And it's on the van runs every night of the year. And then Healthcare for the Homeless in '93 opened a respite, because there was a lot of folks who were not sick enough to be in a hospital, but too sick to be out on the street or in a shelter. So they opened up a respite to take care of those folks. And in '94, the street team added daytime outreach. That's the team that I'm on, and it consists of 3 physicians, including two psychiatrists, an internal medicine doc, nurse practitioner. We have a recovery coach who has had lived experience. He actually experienced homelessness and substance use, so he's a terrific person for our team. Healthcare for the Homeless takes care of approximately 11,000 patients a year at over 30 locations. So every major shelter in Boston has Healthcare for the Homeless physicians and nurse practitioners working at them. And then the respite, Barbara McGinnis House, which I mentioned, has 124 beds. Barbara McGinnis was, as I said, she was a real leader in homelessness, a very strong force. And she said, if you wait for folks to come to your clinic, it's too late. You have to go to them wherever they are. And I think today this speaks really clearly to psychiatrists. For a long time, psychiatrists would wait in their office for homeless people to come, and homeless people never came. So it was clear that we need to go to the people. And I'll just mention the respite. It's a medical respite, but sometimes people can go there not for a medical reason, but for a detox, and just for a break from the street. There's mental health care there, and the most important thing I think is case management, because a lot of people who are homeless, they don't have an ID, they need food stamps, they need to get on a housing list. So the case managers at McGinnis help them with that. That's the atrium and the outside area at McGinnis. And this is a man who is getting care for his frostbite. The nurses there are great, they're so tolerant and patient. And Women's Lunch Place also has a team from Healthcare for the Homeless, and it's just 2 blocks away. It's a day shelter for homeless women. And I think the great thing about Women's Lunch Place is that it's a very hospitable place where people really feel comfortable, especially people with serious mental illness. I like this picture because there's the State House and the sign for the Boston Common in the map. And these are 2 of my colleagues who do street outreach. And in the background, you can see some homeless folks hanging out on the wall. And this is, stooping down is Jim O'Connell. Every Friday I get to do outreach with him, which is really fantastic. And this is one of our docs doing street visits. This man here, it took about 6 years for him to come into the clinic and get some medical care. So a lot of what we do is engagement, and that's one of the reasons we're out on the street, is to get to know people and build relationships. so they can trust us and then come in for psychiatric care, substance use care, and medical care. This is a man on the Boston Common. He had lost both his legs to frostbite, and one day we saw him and he was really, really ill. His stumps were infected. So this is one of our nurses trying to convince him to go to McGinnis House. He eventually went, but it took a long time to convince him. This is another one of our docs. And this, I just wanted to show this picture of the Pine Street outreach van. And I love this because it's in front of the State House. I just think it's a really beautiful picture. This is one of our folks who, he's pretty much lived at the Boston Public Library. So we'd go to visit him and, you know, ask him what he needed, and he'd say, an egg sandwich from Dunkin' Donuts. It took us about probably 7 years to convince him to come inside. And this is another folk that we know. You can see what he has to carry with him every day. He just accumulates so much stuff. And he was really, really difficult to engage. For many, many years, he would just tell us to get away from him. And he was just really, really paranoid. Eventually, we discovered that he had skin cancer. So we had to send him to the hospital involuntarily. And then he got a guardianship and got the cancer removed. And then eventually he went to one of our houses and he did pretty well there. That's just a close-up picture of the stuff he carries with him. And he had that cone. Sometimes he'd sit on a park bench and he'd put the cone in front of him so no one would go near him. It's really, really sad. So I'll just tell you a little bit about this woman under the umbrella. We encountered her at South Station, and she wouldn't take the umbrella down to talk to us. So we tried for weeks and weeks, you know, asking her if we can do anything for her, and she wouldn't talk to us. So one day I said, "Would you like some lunch?" So she took her umbrella down and said, 2 hamburgers, 2 French fries, and 2 Cokes. So that was the beginning of our relationship. She eventually, the sad thing about her is, I asked her name and she said Mr. and Mrs. Michael Jackson. And she thought she was married to Michael Jackson, even though Michael Jackson was dead. And she thought that she thought she was pregnant and she was gonna have triplets, and then she was waiting on the bench for him to come and take her to LA, where she would go and live in a mansion and have his babies. And she had that delusion for quite a long time. Even when she went to the hospital and got medicine, but she still insisted that she was married to Michael Jackson. She finally, after maybe 5, she actually had to go to a state hospital and was hospitalized for a while, but then she went to a halfway house in Cambridge and did really well. She would come to my clinic and meet with me once a month. She was just very, very charming and fun to talk to. But one time I said to her, "What's going on with Michael Jackson?" She said, "Oh, I don't think about him anymore." So I thought, oh, maybe the medication's working. This is a man who we tried to outreach for about 10 years, and he was just very sad. He had tattered clothes. He would never really talk to us. He would take a Dunkin' Donuts gift card and maybe say hello, but we just tried and tried. And sometimes I'd go out with folks. Actually, Tracy Kidder, who wrote the book about healthcare for the homeless, said to me once, "Why is that guy out here? Like, can't you do anything?" But the frustrating thing is it's really hard, as probably a lot of you know, to get people into the hospital. People have to be dangerous. So sometimes if people are out on the street in the cold, it's really not enough to send someone involuntarily to the hospital. And the thing I think that a lot of people don't understand about mental illness, I think a lot of people think, well, why don't they just get help? But with this man has schizophrenia, and that's a brain disease. And he had paranoia, and he spent a lot of time talking to voices inside his head, and didn't have any relationships. So the issue with mental illness is that people don't understand they have a mental illness. So it's not like people are in denial or are stubborn or just difficult. They really just don't know that they have an illness. You know, if you fall down and think that you broke your leg, you think to yourself, well, I better go to the emergency room and get an x-ray, and then maybe I need a cast. But folks with mental illness, not everybody, but a lot of folks with mental illness, and a lot of people you see out on the street who are, you know, screaming at voices, just don't understand that going to a psychiatrist might be helpful for them. Oh, this man, I wanted to say, it was really amazing because he was hospitalized for a long time, and then he went to a group home, and he told me he had 6 siblings, and that he grew up in Dorchester. So I asked him if he would want me to track any of his relatives down, his siblings. He said, no, I was the black sheep in the family, and I don't think I should contact them. So after a while that he was on meds, he became less suspicious. And he said to me one time, I want to try to find my family. So he told me all his sister's names and his mother's name. And then I Googled, and I found his sister. I found about 4 of his sisters. So I wrote them letters. I didn't want to be pushy, and I didn't know what the relationship had been in the past. But 2 of the sisters called me on a conference call, and they were crying, and they said, I can't believe that you are taking care of my brother, and we really want to see him, and we tried so hard to find him. Sometimes our children would see him on the street, in the subway, but he wouldn't talk to anybody. So now the sisters go to visit him at the halfway house and take him to restaurants, and they have a really good relationship. So it's just really fantastic to see him be so happy about having a family involved. And the last person I'll talk about is one of our patients who, he was a Boston Common person. He wandered around Boston Common digging through trash piles. He didn't go into any of the food programs to get food. And I'd always ask him, you know, how you doing? Do you need anything? And he'd always say, I'm fine. I don't need anything. Sometimes he'd have lice on him. So this is him in his apartment. He finally got housed, and we go over to visit him a lot, and he's really content. I'm not sure if you want me to tell you a couple more stories or if you want to ask questions. Why don't we start with questions, and then if we have time, I can tell you a couple more stories. Yeah.
So there are a number of local people that are on Cambridge Street that I walk by all the time, and they're very friendly and things, you know, but I feel like they're either on their way to Mass General in an ambulance, you know, it's just this rinse and repeat, and I wonder where's the space in between, you know, because I have called the van. I stopped it in downtown Crossing the other day trying to find someone, and I see a lot, and I feel like unless, like you said, they're really sick, and not just for the women, the men, is there a day shelter, you know, where, like if they're, you know, the emergency room just spits them back out.
Yeah.
You know, and then they end up outside, but like, where, is there something being developed? Or do you feel like, I feel like there's a higher present, a higher population. Do you guys feel that? And is there anything in the works that could be a place for them to go during the day? Because some of the ones that I've talked to said they don't like to sleep at night in a shelter. They feel that it's dangerous. So they sleep during the day. I don't know, like,
Yeah.
where should they go or what?
Yeah, I share your frustration to see people outside for just a really, really long time.
Yeah.
There's there's a couple of really nice day shelters. There's St. Francis House, I don't know if people have heard of that, but they have breakfast and lunch and clothing and showers and medical care and psychiatric care. So that's a good place to let people know about. And I think sometimes it's helpful if you give people directions and address, let them know what's available. Then there's Women's Lunch Place that is for women, and that's just a couple of blocks. It's 67 Newbury Street, and that's a beautiful place. I was actually part of founding the Women's Lunch Place, and I was working at Pine Street and there was no place for women to go during the day. So a friend and I decided to open up a place for women. And we were, 26 and very naive. But Church of the Covenant, which is 67 Newbury, said we could use their basement. So at the time, there was no place for women to go during the day. And the women at Pine Street was closed during the day. So some of the women, especially the ones with mental illness, they would just stand across the street from Pine Street and talk to their voices for hours and hours and wait for the building to open up again. So my friend and I just were like heartbroken for the women that had no place to go, and they'd say like, we don't even have a place to go to the bathroom. So we got Church of the Covenant to let us use the basement, and so since '82, there's been a place for women, and it's also for people that identify as women.
What is the downtown crossing? Is that a shelter downtown? Near Macy's that I walked into, and there's somebody at the door. You can go in.
Near Macy's. Oh, it's not Arch Street, the church.
It's like near Brattle Bookstore, kind of.
West Street, and West Street.
Oh, is it? I walked in the other day.
That's for adolescents. Bridger.
Oh, there's a shelter for adolescents.
Oh, okay.
Yeah,
Okay.
that's Bridger with Troubled Waters. That's probably it, yeah. But I think that, if you see someone that you think is in trouble, especially on a really, really cold night, you can call Pine Street and the outreach van will find them. If you just call the main number, if you look up Pine, I don't have the number with me, but if you look up Pine Street and then there'll be a menu and just ask for the outreach team. And then they will, you can just help, just leave a message about where the person is and that you're concerned about them. But there is like a revolving door for a lot of people. There's a poor woman who we know really well who lives in South Station, and she can't stay during the night at night because they close down. So then she sleeps in a doorway, and she's only 27 and she's very seriously mentally ill. But she's been at Tufts and Cambridge Hospital and many, many hospitals. But they only keep her for about a month and then discharge her. And she says she doesn't want to go anywhere. Like we offer her shelters and houses from DMH, but she just says, what she says is an excuse. It's really poignant. She says, my children need to find me and they know I live at South Station, so they're gonna come and get me. But she's been there for 3 years now and her children are grown and they're estranged from her. I think they're in Rhode Island, but but it's delusional and she thinks she's pregnant and the baby is crying out for her, and, you know, a lot of false beliefs. She told us she had a house, and then we asked her, where's the house? And she said, oh, you have to ask the police where it is. And she's gonna be discharged from the hospital again, and is going back to South Station in a couple of days. So in terms of your question, like, we just keep working and working and working and hope that someday, I mean, a lot of the people that I work with get really, really discouraged and angry at the hospitals, but I say we just have to have hope that at one time when she goes to the hospital, you know, they'll keep her longer, and then she'll accept medication and housing. And I've seen the reason I stay hopeful is because I've seen so many people who have been outside for years and years, and they finally get treated, and they accept housing, and then they don't ever say, I want to go back to the street. Like, why did you put me in a house? They're always, you know, they're always very content to be housed and to have a bed to sleep in.
So that leads to the question of, is the solution housing for the population of mentally homeless?
A lot of people say housing is the answer. I don't agree with that.
Yeah.
I think that the folks have complicated problems, and a lot of people go into housing and they fail. So we know some folks that have had 7 places and keep getting evicted. Sometimes it's because people are using substances, and then they invite their friends over, and then the landlord gets upset. So what people need is, besides a house, and housing is definitely helpful, but support.
Yeah.
And that takes a lot of work.
So would it be housing with then a group home housing support initially that states could begin to lobby to create, or, you know, to really approach this holistically?
Mm-hmm, mm-hmm. One thing that we have that the Department of Mental Health runs are, they're called safe havens, and it's low threshold housing. So there's, there's 7 of them spread around Dorchester, East Boston, Boston proper. And what it is, and I think it's a really great concept, it's housing where people get their own bedroom, and then they get 3 meals a day. They're staffed 24 hours. They help people with medication. They help people with, you know, trying to find something to do during the day. Just a lot of support. But the places are very, like, tolerant and open, and, you know, people don't have to be sober, and people don't have to be even treated for their mental illness. So it's pretty much meet people where they're at, and then bring them into housing, and work on helping them with their issues.
Is that outcome better? Are those measured outcomes better than more restrictive housing situations then?
Yeah, I don't think there's ever been a good research study, but what we found, and I'm the psychiatric consultant to the safe havens, and what we find is that people pretty much stay. And I think with more restrictive, like if there's rules, one of the DMH shelters, Department of Mental Health shelters, people have to leave during the day, and that's really hard on folks, because then they feel like they're homeless, and if they have nothing to do, then they just kind of wander around the city, and then they have to wait till 4 o'clock to go back into the shelter. So a lot of folks don't like that, and I think if there's rules, like you have to be in at a certain time, and sometimes there's rules like if you don't sleep in your bed, then you're gonna lose your bed. A lot of restrictions. So I think probably the looser the better. Being loose, but combining that with a lot of support, I think is the solution. Oh, that's a great question. Pine Street, unfortunately, took their laundry machines out. And I think Women's Lunch Place is a place where people can do their laundry. I don't know where the guys get, I should find out. I don't know. A lot of them,
Sometimes I see people in the park with a paper bag with a label on it. Seems like someone's doing their own.
oh, really? Oh, well. It's not a hospital discharge bag,
No,
you don't think?
it's
No.
not plastic.
Oh, oh, wow, wow. I don't know of any place where people can go and get their laundry done. It's hard when people don't have any money for even washing machines. So laundry is a big problem.
Do you get support from like interfaith? Because I know that a lot of churches are also trying to set up support for,
Mhm.
for homeless and things. Do you see that coming into the organizations you're working with, or is that kind of separate? I live in Cambridge and I spend a lot of time outside of Harvard and I see the fridges that they have. Lots of the churches have fridges that they can come and they'll set up and have clothes and things, but it's just kind of pouring out. I don't know the situations around like bringing people into facilities. So I was just curious if you see support from so many churches that are trying to do good things, if they're supporting you in the efforts that these organizations are like that you mentioned.
Yeah, one church that comes to mind is St. Paul's, which is right on the Common. It's on Tremont Street. And they have, they actually do some outreach in the Common. And they're open on Monday for lunch. So our street outreach team goes and asks the folks that are working there, who might need something or who seems to be, medically ill or psychiatrically ill. So that's a great place. They actually have, St. Paul's does a noontime service right on the Boston Common. So a lot of homeless folks feel really supported. And then about, it's probably been 10 years, a lot of the churches got together and decided that they would open up for lunch. So there's one at Emmanuel Church that's open Wednesdays and Fridays. And we go there also and work with the staff. So there are places. I think the churches are pretty committed to helping. And then the Church of the Covenant let us use the basement for the past 40 years. So that was pretty nice. You had a question.
Oh, it was actually very similar to, I was just echoing how we as a community can support and just kind of provide that empathetic, emotional support. And I'm actually a member of Church of the Covenant. And so I'm actually a member of Church of the Covenant.
Nice.
So it just sounds like just providing that extra emotional support to the community in any way that we could maybe eventually get to that insight that you were talking about, and how there is a little bit of a lack of insight in some of those delusional cases, or just knowing that they are supported and that people care and that they are loved.
Yeah.
That they are all loved and they're all, children of God. To kind of just inching their way there. Just kind of, I don't know, just kind of an echo of her question, but if that makes sense.
I think sometimes people say to me, well, if I come up upon a homeless person on the street, what should I do? Sometimes it's intimidating to, and you don't know whether you should approach them. So I just say, I've learned a lot from engagement about how to approach people. And it took me a long time to learn engagement. But I usually say like, hey, how's it going? And, talk about the weather and, say, how's your day going? And that kind of disarms people. And then I'll say, if I have time, I'll say, do you want a cup of coffee? Because that's always something that homeless people want, is a cup of coffee. What we do for engagement is, in the winter, we carry gloves and hats. We really can't carry like blankets and coats because it's just too much. But we have, basic warming materials for the winter. And then we always carry socks because homeless people always want socks. And then we have Dunkin' Donut gift cards or McDonald's gift cards. And that's really helpful for people, especially if it's really, really hot. People can go in and be in an air-conditioned place for a little while and just have a break and be able to sit down and have a cup of coffee. Or we give, and sometimes I'll just buy people lunch or a cup, like I said, a cup of coffee. So that's really helpful. But I think the most important thing is to acknowledge the person as a person and look them in the eye and smile and say, like, have a good day. I think a lot of people, there's so many people who are outside or in shelters who are really lonely and never get a chance to talk to anybody. So if you have a couple of minutes to just ask people how their day's going, I think that goes a long way, and then people start feeling like they're a human being and they're not an object that people are ridiculing or staring at. Yeah.
Obviously you've been in this a long time. Do you feel like it's trending positive, or do you think the crisis is getting worse, or how do you?
I think with the opioid epidemic, things got worse over the past 10 years. When I first started this work, we would see a lot of people addicted to alcohol, but not so much opioids. And now there's a methamphetamine epidemic. A lot of people are using methamphetamines. So I think that part is getting worse, and it's really hard to know what to do for folks who are using heroin on the street and don't want, that they're just so entrenched that I think it's hard for them to even imagine not using it, not using the heroin, or the fentanyl. So that part is, I think that part is worse. I think the positive thing, when I started, I've been doing street outreach for 21 years, and we never had any hope of housing people. And now there's a lot of money going into housing. So that's hopeful. Sometimes it will take people 5 years to get a place, but at least they'll get a place. And I always tell people, just be patient. And I know so many people that waited and waited, but eventually they got a place. That's kind of a hopeful thing to let people know that one of the good things is Pine Street has outreach, and ours is more medical and psychiatric, but theirs is case management. So they will work with people and get people on housing lists. And a lot of people have to go through such hurdles to get housing. They need their birth certificate. That's hard to get. It costs money. And then they need an ID. And if they're getting Social Security, they need a copy of their Social Security form. So there's just a lot of hoops to jump through. But the case managers from Pine Street will help people with all that. So that's really helpful.
We have time for one more.
How has the migrant situation affected the homeless people?
It's been really tough. When I go to Pine Street, there's many, many folks from, Venezuela and Haiti. And I see people with families wandering around when I do outreach. And that's been really hard. And the family shelters packed. So it's been hard. I think it's been hard for Boston. I'm not sure what the answer is, because it's so expensive to live here, Yeah. One more?
I was gonna ask more personally, how do you remove yourself when you're all day? It looks like you're almost building relationships with these people. How do you personally in the evening, like relax and touch, that heaviness, or Is it on your mind all the time?
You know what the hardest thing is when it's, 0 degrees with the wind chill? And I think about all the people sleeping outside, and I'm going home to my warm house. And sometimes I just can't get both, especially because I know people individually, like I really know them. So it's hard. The cold, I just can't imagine being cold and not having a warm house to go to. So that's really hard. I think, but another thing that happened was, there was a poor woman that I was trying to help, and she was on thyroid meds and she wasn't taking the thyroid meds, so she ended up in a coma at Tufts. And I had been on vacation, and I got back, and I heard that she was she was delirious in the ICU. And I just felt so bad. I just felt like my heart was broken. And I was thinking, she has serious mental illness, and she doesn't really know what's going on. And she didn't realize that thyroid medication, she could get so sick from not taking the thyroid medication. So I think like, I try to take care of myself. I try to take vacations. I try to meditate. I'm not really good at it, but and I have a lot of friends my partner who are really supportive, so that helps a lot. My partner teaches at BU, and he's gotten to know a lot of the homeless people. He used to take care of everybody in Kenmore Square and buy them chicken and buy them, coffees, and so because he knows homeless folks, it really helps me to have him around. I don't know, does that answer your question? Yeah.
Well, all I can say is, we're so